posterior arch of C1 and runs nearly superior to the base of the occiput. A lot of the setup is going to be the same from before, so the patient's supine with mild upper cervical extension. The slight difference though is we need to put him in slight lateral flexion. This will soften up the superficial structure so that we can bow semispinalis capitis out of the way. I also like to position myself here too so that my non-contact hand supporting his head is midline with him. For our depth, what we need to do is, again, having that elbow a couple inches off of our thigh, we go isometric. We're going to be using the tip of our index finger with the middle finger back up for this contact. Again, I identify C2 and I go just superior to that, midline. As I isometrically sink into the tissue, I'm sinking in between the nuchal ligament and semispinalis capitis. The next step from here is we need to flex our finger to bow semispinalis out, and then this will allow us to gain access to the tissue. So again, I sink, I flex my finger, being careful that I'm not flexing over semispinalis capitis. Oftentimes you can roll over that tissue. I take my second depth. Again, this is a deep tissue here. From here, the tension is going to be a pull. So I'm pulling into myself, not pulling 45 degrees. Going through the steps here again. I sink in, flex the finger, sink again, tension, and apply an inferior pressure to the top of the head to help guide the movement. Again, I feel a deep, firm